So a lot of people think that they can pull back on their skincare in the summer months because I'm guilty of it. I do like the sun. I like a wee bit of kissed skin. So what would you suggest for us when we're going out in the sun? What are the differences that we need to make to our skincare routine, and what are the most important things that we should be including on a daily basis?
Okay, well, I think in the summer we don't suffer as much with dehydration as we would in the winter, so you could maybe pull back on your moisturisers or your hyaluronic acid serums, but definitely do not pull back on your SPF. It is so important. It is so important, not just for, I feel like a lot of people think that an SPF just prevents sunspots and pigmentation, but it actually does so much more. It attacks your collagen.
Yeah, and that
really,
with the dryness, the laxity of your skin as well.
Yeah, it's just so important. So, and especially in the summer months, top up on your SPF throughout the day. I mean, I know Nikki said that she likes that sun-kissed look, but it comes with a lot of damage with it. Okay, you're going to be tan for a few weeks, but the damage that's going to happen to your skin throughout that, and there's so much you can get now. You can get these facial tanner mists. I actually really like the Saint-Tropez one. It's called Water Purity.
The Saint-Tropez one.
Isn't it so nice?
So good.
And it's really, really lightweight. So if you like that kind of look, instead of damaging your skin long term, wee bit of Saint-Tropez.
Sarah coming on. Hi Sarah. Sarah asks, is it true I have to apply SPF every 2 hours, even when indoors? I wear it regardless, but not sure if the 2-hour rule applies inside.
It depends on the manufacturer and the brand. Usually it's 4 to 5 hours, but again, depending on the SPF ingredients. So what you really want to be looking for is titanium dioxide and zinc oxide, and they're physical SPFs. If you're using brands that have them ingredients, it's every 4 to 5 hours. You need to reapply. It does start to dilute and it starts to weaken. So yes, you do need to reapply. When you're indoors, I don't reapply because I wear makeup, but yes, technically you should. You should.
Especially if you're out in the sun.
Yes.
100%.
And you're exposed more so.
Yeah.
But yes.
They say sort of with inside, so you've got your UVA and your UVB factors, and a lot of people think that the sun rays can't go through the likes of windows when you're inside and things like that. Like, you have a lot of people who go in the car and drive in the car and don't think they need. So, you know, what would you suggest to people who maybe work with jobs that are driving as well?
Well, that's interesting because we would get a lot of people, we can tell if they do a lot of driving because of the damage to the right side of their face.
Your aunt had that today. She had pigmentation all down her driver's side. It's so common. Do you ever see that photo of a truck driver over 40 years, like one age, like that's it. It ages your skin. You lose elasticity and collagen, pigmentation, uneven skin tone. But yes, it's really important indoors as well. We get them rays bouncing through the room. We also get them off our phone. There's certain
computer screens.
Yeah, all sorts. So it's important that you wear it every day. I would be more particular about application reapplying if you are in direct sunlight.
Yeah, sitting outside into it.
Yes.
And that's the thing as well. People think, you know, because obviously here we don't get like really good sun, but it doesn't matter. The UV rays still come through. They come through on cloudy days, dull days.
Winter days.
It doesn't need to be over a certain temperature for that damage to be like those damaging rays to be coming through.
So Sarah has sort of said here that I never wore it before retinol, but now I'm an addict. I'm addicted to it. So with regards to that, goes on to another question with regard to retinol. So there's a lot of people who, we all start retinol, we know how good it is, but some people advise come the summer that you should back away from it and ease off on the retinol and then restart it again. So what would you suggest when you're using retinol? Do you need to reduce the amount of times you're using it?
No, I disagree. I totally disagree. If you're using a good SPF, no, your retinol should stay the same throughout the year. But when you're using it in conjunction with an SPF, I mean, you shouldn't be using a retinol if you're not using an SPF.
Yeah.
The two go hand in hand.
They do. So yeah, you should definitely not be cutting back in the summer.
No, and because retinol as well, it takes a while for your skin to build up, you know, so you'll have made that progress and maybe gone up a percentage or whatever, and you don't want to lose progress.
Yeah.
And what would you suggest for anyone who maybe hasn't been using the sun factor, and they have developed some sunspots, particularly as they get older and things like that. We're noticing them a wee bit more. What sort of treatments, are there out there? I know some people obviously will go for the injectable treatments and like that, if they know it's getting under the skin blisters, things like that. And also there's the ones we prefer not to. They prefer the more aesthetically ones, not invasive type things. So what sort of treatments would you recommend for the likes of sunspots?
Sunspots, I would treat more sunspots than Kat would.
Yeah.
Because I'm more surface.
Yeah.
And I actually love treating sunspots. So we do a facial called the Photofacial IPL by Venus, and it's amazing. So it's an IPL treatment that attacks the pigment of the sunspot, and it literally crumbles off after about 5 days after the treatment. Now it will always come back. Maybe you might get a year or 2 years out of the treatment, but as long as you use an SPF and you're not exposed to that, the rays, the pigment won't come up as quick. Peels are also amazing for sunspots, pigmentation, for evening out your skin tone. But when you have them big, heavy, dark sunspots, the IPL is amazing. I love it.
Yeah, and it'll look worse for a couple of days, but then, as you say,
it gets darker because it comes closer and closer to the surface.
Yeah, we do as well. I do the perfect peel, which is it's a really intense peel, and your skin literally does peel off, but it's really good for lifting off the pigmentation. It gets right down into the deeper layers of the dermis, so it gets right down in there rather than like a superficial peel. So if you wanted to go for something more heavy duty, it's good for pigmentation and scarring as well, any like acne scarring too.
And the other thing that we find coming up a lot of people, and it's come to the surface, is we talk about the face all the time, but we always forget about the neck and the chest, rocks that nobody knows. What would you suggest?
SPF on, bring your SPF right down to your neck and your décolleté, and also onto the back of your hands. Do that daily. I also think it's important to bring like your vitamin C serums and anything that stimulates onto the neck.
You should see like this part of your body as a continuation of your face. So whatever you're doing up here, you should be carrying down here as well.
Definitely. And also, Kat's mum just had that. She'll not mind us saying this.
Yeah.
She had the Venus Legacy radio frequency on her neck there. So she had 8 treatments. So it's a course, 1 a week for 8 weeks, and we just use a machine that helps to stimulate your skin's collagen and elastin. And what
it just looks so much
tighter.
Yeah. It just looks like it's taken years off.
Hasn't it? And she just looks amazing. But what it has done is your body does all the work. We stimulate your skin's natural collagen and elastin, so it tightens this area, because we do age quicker here, because the skin's a lot thinner. But that's a really good treatment. Venus Legacy radio frequency, really amazing. Good.
So tell us this: we experience a lot through the week with regards to our skin. Give us your best and worst experience this week.
On our own skin?
Your own skin or somebody else's?
Well, my last client, she was from Australia, and she had quite a bit of sun damage on her skin. Now she was in her 60s, so obviously SPF and us being educated on SPF's only been a big thing, 20 years. So there was been a long time she didn't use SPF, so she had quite a lot of sun damage, especially on one side of her face. And she didn't know that there was treatments out there to help it. She also doesn't really use serums or a good SPF. So that was quite interesting. But she left with she was a lot more educated when she left, and I think it's really going to change her whole skin and the way she thinks about it with the products and stuff that she's took. So that was a good and a bad one. Yeah, we made it into a good one.
We learned.
Yes.
Oh gosh, good or bad for me? It's always SPF for me. I can't accept people not using SPF. I just can't, because if you're coming in and you're spending hundreds of pounds on injectables and treatments, why would you not spend 30 or 40 pound on a really good SPF? It's going to help you get longer. I think that's the thing as well. It's a real misconception, because you can't, if you're somebody that takes colour, you're going to get a colour even if you use an SPF. And that's the thing that people don't understand. They think that an SPF is literally going to block out, but it's not. It's just blocking out, or hopefully blocking out, the majority of the damage. So you can still get a colour, but just not get the damage with it. And actually, another thing is, if you use an SPF in the sun, your tan will last longer, because it won't have damaged your skin as much, because damaged skin doesn't last. The colour on damaged skin doesn't last as long because your skin sheds quicker when it's damaged.
Oh, that is so, that's a good way of putting it.
There you go.
I think Kat is like, you're going to be like the ambassador for SPF. She's never going to age.
I've never aged.
She's been using it for years and look at her skin. This girl does not have a pore.
Well,
it is true.
It is true, you know.
Wow.
So also we have another new treatment out at the minute which I am loving, which is Cinicos
Yes.
for under eyes, and it's a big problem that we all sort of suffer as we get older. It's the under eye area, and it's just like anything. There's nothing really that can fix it, but all of a sudden now we've got this new treatment which is Cinicos. And it is amazing for dark circles, bags. So tell us a wee bit more about this, Kat.
Yeah, so Cinicos is, I really like it as a treatment because it is an injectable, so there is a little bit of downtime with it, but I think it's more sustainable than potentially getting under eye filler. So you can do things for under your eyes, like you can get a good retinol eye cream. Using an eye cream, using SPF around your eyes is really good. But naturally, as we get older, our collagen supplies just decrease, so the skin will become more lax. Another thing as well for around the eyes is sleeping, getting a good amount of sleep and water. You can really tell somebody would be dehydrated around their eyes with how much water they drink. But you can treat around the eyes with anti-wrinkle, and that will do your crow's feet. But this skin, Cinicos targets like right in here, and that the wrinkles and sort of crepiness under there isn't really, anti-wrinkle isn't going to really touch, because that's not muscle, that's your skin. So this targets the skin. So it's a boost of biotin and collagen, and as well as that, because it is lots of little injections, it almost acts as a little bit of microneedling as well, which will resurface and help to boost your skin's natural collagen production.
And when you talk about the downtime, what sort of things should we expect with the downtime? How long is the downtime regarding that?
Yeah, so downtime, I mean, initially after you've been injected, you will be swollen, but by the next day you should be okay, you should be good to go. I had it done myself, and I had a couple of just little pin marks, which were fine. It was easy enough to cover them up with makeup. However, you can potentially get a couple of bruises. It is a very vascular area, so there is a potential for a bruise, just in case, just so that you're aware. But 99% of the time, by the next day, you're good to go.
And what other treatments is there for the under eye area, Carla, that maybe isn't so invasive than getting injectables? You know, what would you recommend?
We do microneedling under the eye area, like Kat said. So really good for like boosting your collagen, helping with any fine lines and softening them out, especially like if you have deep lines around the crow's feet area, if you didn't want to go for anti-wrinkle. So yeah, that's a really good one. Or if you feel like your skin's quite loose and lax around here, the Venus Legacy, we do the eye treatment, so it's just focused on the eyes. We do a course of them, so 1 a week for 8 weeks, and it really helps to tighten this area up if you feel like you're loose around here, which a lot of women do get loose around their eyes.
And tell us this, with regards to your own skin, what is your go-to product that you use in your own skin? Because we always look at everyone's skin and sort of like wonder what we're using. I know everyone has something different, but it's always nice to know and share those experiences and things that you really love. So what would your hero product be?
My hero product, hands down, is vitamin C. I have used vitamin C on my skin for like 8 years straight, and I mean a good vitamin C, so medical grade vitamin C, L-ascorbic acid, minimum of 10%. At the minute I'm on a 15% L-ascorbic acid, and I can't live without it.
And what's the difference between, because you're saying medical grade, because there's a lot of vitamin C products out there?
There's so many vitamin C out there, like you can go into Boots or any sort of chemist and get vitamin C off the shelf, and it has to be a stabilised formula of L-ascorbic acid, so you want to be looking for L-ascorbic acid on the product. And the difference is unbelievable. Like when you go for a good vitamin C, and you can tell by the price point as well. We were talking about this, like it is going to be over £100 for a 30ml bottle, easy, but it lasts.
You need so little of it because your body can only absorb a certain amount. So you can put on loads of it, but your body's only going to absorb
so much,
the same amount. So when we say you only need 4 or 5 drops, you literally...
That's all you need. And it spreads so easy because of the formulation. It also, it's only once per day, so you just use it in the morning. But what I love about it is the glow. It gives my skin the most amazing radiance. I don't use, at the minute, I'm actually not even using a hyaluronic acid serum or moisturiser. I just use vitamin C and SPF, and that's enough for me. Vitamin C also helps to stimulate your own skin's hydration. So it helps with hydration, helps with fine lines, helps with overall like even skin tone, a glow. Everyone needs the vitamin C. I love it.
It is really good. My go-to, obviously other than SPF, is I use a salicylic acid like a toner, because although they're saying that I have no pores, I do. I would get quite open pores along my like cheekbones, which I think a lot of us can suffer from. So I use that maybe 2 or 3 times a week, and I just sort of sweep it along sort of those like problem areas. So I'll really target here around my chin and around my nose, and I just find that helps to just really like tighten everything up and makes your skin feel so fresh. And it also acts as like what's the word, an active exfoliator, chemical exfoliator. So obviously when you think of an exfoliator, you think of like something like rough and beaded, and that can actually be more damaging to your skin because it's really abrasive, yeah. Whereas a chemical exfoliant like that is softer on your skin in the sense, but still does the job. And
it does the job so much better too.
Yeah.
So that was a really good one. Yeah. Okay, that's my second one.
Yeah, can't live without it.
Pore therapy.
Pore therapy, yeah. So we sell it here in the clinic. It's called Pore Therapy, and it's so good. I use it about 3 times a week just to help like tighten up.
And it's good for all skin types as well, because it's good for younger skin because it has the salicylic, which is great for like blackheads, congestion, breakouts, but it's also great for an older skin type as well because it's anti-inflammatory. So if you suffer from rosacea or you don't, a lot of older ladies don't like to exfoliate their skin, this is in like a toner formula, so it's just a solution. Just sweep it across the skin and it does all the work for you. I love it.
And you need very little of it as well.
You do. I use it every day. I use it 3 times a week, but you can use it every day or you can use it a couple of times a week, but everybody needs it.
Girls, thank you very much, and we will be back this week to bring more, so enjoy the rest of your day.